Alyce Arnella, thank you, and I believe Sam has entered the room. Yes, welcome,
Stand
Sam.
up and say hello.
Sam has the coolest sweater on. You have to see Elma on the front. Hi, Sam. All right. All right. You're never
He can have my seat if I can have his sweater.
Yeah, just not for a while. Yeah.
So 3 years ago, my husband and I were expecting our first child. At the time, we were self-employed as small business owners, and we couldn't afford the high cost of health insurance. This was before the ACA. When the Affordable Care Act was passed, we found an affordable plan in the marketplace. Suddenly, all of my prenatal care was covered. My pregnancy was completely normal and uneventful. Just as everyone hopes, the plan we signed up for through the marketplace covered advanced testing for genetic conditions, and all my results came back clear. But then the unexpected happened, as tends to happen. No one wants to face the devastation of their baby being born with life-threatening medical problems, but that's exactly what happened to us. Our son Sam was born with multiple congenital birth defects, none of which could be detected before he was born. He was rushed by ambulance to Maine Medical Center in Portland when he was just 2 days old. The pediatric surgeons there performed surgery to save his life. The medical bills in his first month of life alone topped $100,000. Within his 2 years of life, Sam has been seen by nearly a dozen specialists and has gone through 20 tests and procedures to ensure that his health remains stable. Later in infancy, Sam was approved for SSI benefits, which meant he also became covered by Medicaid. And the transition to that coverage was seamless. I only needed to make sure his pediatrician put in authorizations for his medications and specialists. He was able to continue seeing the same specialists that he'd seen since birth, and his Medicaid coverage has fully provided for every test and exam he's needed. Knowing that Sam can receive all the care his doctors want for him has greatly lessened the anxiety we felt regarding his multiple conditions. His access to testing has enabled us to confirm positive status changes in some of his conditions, which has allowed him to go off certain medications sooner than expected. Sam is now a thriving, happy 2-year-old who seems just like any other kid his age. I've been able to return to work part-time since he's doing so well. Sam's healthcare needs, however, will require a team of pediatric specialists to ensure care for him throughout his childhood. The protections the Affordable Care Act has provided ensure that we have been able to get him the tests, medicine, therapies, doctor visits, and he needs to stay healthy. The Affordable Care Act ensures that he can never be denied coverage and that our family is not charged exorbitant premium fees and high deductibles because of his medical needs. It means he'll never face lifetime limits in coverage for the conditions he's had since he was born. The Affordable Care Act has been critical to how well he's doing today. Due in part to our fears regarding the ACA repeal, my husband and I have both given up self-employment so that we can attain more security regarding health coverage in the future. My husband has recently accepted a job that will take him away from home more than we are used to, but it comes with a solid employer-based health coverage for our family. This is our priority now that the new administration and Senate Republicans have made ACA repeal their first goal. However, I cannot rest assured that Sam's long-term future will be as secure if we lose the provisions for no denial of pre-existing conditions. I fear the return of yearly or lifetime limits on coverage. Sam. And high-risk pools. What if my husband loses his job? What will healthcare access look like for Sam 5 or 10 years from now? What will be available to him when he is an adult looking for coverage as a person who was born with multiple medical conditions and has a complex medical history? No one should face financial ruin because they need medical care, and no one should be forced to go without medical care they need. It would be irresponsible for our representatives in Washington to pull the rug out under from millions of people around the country who have health care because of the Affordable Care Act. I know how it would affect my son's life if that were to happen, and it would be devastating for him and our family.
Sam is the happy face of Medicaid. If there's $1 trillion in cuts to Medicaid and Sam is not able to get help through Medicaid, what happens to Sam?
Medicaid has provided him to be able to go to his kidney doctors and to keep his status check on his kidneys, which is what we think his long-term issues are going to be. Medicaid has been there to cover tests for swallowing function, for all the different parts of his bodies that are affected by his disorder. So my fear is that, if we do get employer-based coverage, anything can happen in life. What if my husband lost his job and then we didn't qualify for Sam to get Medicaid anymore? How would we deal with that double whammy of losing employer coverage and then not qualifying for Medicaid for a medically complex child?
Thank you. I'm very grateful to all four of you for putting a face on what Medicare and Medicaid means. I suggested yesterday to Congressman Price that if he is confirmed to be the head of HHS, that he cut out the statement of Donald Trump, "I will not cut Medicare or Medicaid," and tape it above his desk and look at it every single day, because you are what that's all about. You are the reason we must not cut Medicare and Medicaid. Thank you. Thank you for being here.